Greetings, fellow congregants. I'm Alice Faryna, here at the invitation of Reverend Marion to talk to you about my favorite subject, healthcare. I will review the behavior of pandemics, the behavior of viruses, and end with an analysis of our healthcare status. Plagues, pestilences, and pandemics are a direct consequence of abandoning our original lives as hunters and gatherers. Once our species settled down to till the earth and build cities, we created the perfect environment for outbreaks of diseases. Densely populated urban areas, along with the domestication of animals such as cats, cattle, horses, which are the reservoirs for pathogens that can be transmitted to human beings. Cities are also the perfect environment for a large population of rats, which carry lice, which carry diseases that can be transmitted to humans. Mosquitoes are also able to transmit parasites and viruses. I am reminded of a 19th century editorial about Santa Claus. Here's my version. Yes, Virginia, there is a God, and her name is Gaia. I have a picture of Gaia that I painted some years ago. Gaia is devoted to nurturing the earth, having no special love for any particular species, including Homo sapiens. She is unlike the male deities invented by subsequent religions. We read in Exodus that Yahweh inflicted upon the Pharaoh numerous plagues and swarms of locusts to force him to let Moses lead the captive Israelites, the chosen people, out of Egypt and into the promised land. Since then, history records numerous outbreaks: cholera, the Black Death, typhus, yellow fever, smallpox, AIDS, Ebola. As the world population grew, so did the opportunity for mass spread of lethal diseases. The 1918 flu epidemic killed at least 50 million people worldwide. Is Gaia, noting the warming of her planet and the destruction of many species, sending us a message? Is she maybe trying to reduce an overgrown and irresponsible population? There is insufficient data to make predictions about pandemics. We need two kinds of tests. First, to test the symptomatic or at-risk people for the virus itself so they can be quarantined and treated if necessary. The other test is for the antibody to the virus. This identifies the people who survived and are now immune. What have we learned from past epidemics? I have some good news and some bad news. The bad news is that we can expect 80% of our population to contract the virus. The good news is that we can expect 80% of our population to contract the virus. It's bad because it will likely be a year before an effective vaccine is produced, so people will die. It's good because the survivors become immune. Vaccines originated in 1798 when Edward Jenner found that inoculating people with the pus from cattle who had cowpox protected them from smallpox. We've created dozens of vaccines since, leading to the total elimination of smallpox and polio. Measles was eliminated from the United States in the early 2000s, but we've had two resurgences in the past decade when international travelers brought the virus back to our shores and infected large groups of children whose parents had decided not to get them vaccinated. This illustrates the importance of herd immunity. Epidemiologists use a formula to calculate how many people in an unprotected population one infected person could pass the disease along to. This number is called the RO. The higher this number, the higher the immunity threshold must be to protect the community. At this point, the virus, which must inhabit living cells to function, cannot find susceptible people and dies out. That's how epidemics end. Measles is extremely contagious. Its RO which is the pool or the herd of immune people, is very high, at least 95% of the population. Some estimate that COVID-19 will have a high threshold also, so the herd of immune people will have to be very large. Current efforts to contain the epidemic focus on collecting enough resources to meet immediate treatment needs and practicing social distancing to slow the spread of the virus. I am keeping track of the statistics in Ohio and the United States. This is Ohio, this is the United States over the past week. You can see that the graph is still climbing pretty rapidly. It hasn't plateaued yet. Non-essential businesses are closed in most states, creating an economic contraction, loss of jobs, and uncertainty about the future. Legislation proposed to address the medical and economic fallout initially had to decide about coverage of tests and medical treatment. Fortunately, for COVID, both will be covered regardless of insurance status. This illustrates the flaw in a healthcare system dependent on employer-based health insurance. If we had universal coverage for all medically necessary tests and treatments, prepaid by progressive taxes instead of fixed premiums, we would not be having dysfunctional debates on coverage of tests as people lose their jobs during this epidemic. Taiwan converted to a single-payer program in 1995. It was modeled on our Medicare program. They also learned lessons from the 2003 coronavirus outbreak, SARS, and were prepared with this epidemic to do mass testing and treatment much sooner than we did. Furthermore, all Taiwanese are issued a smart card on which all their medical information is stored. This gives the central government a useful database for tracking data and responding quickly. Friends, we will get through this. We will also have future epidemics, since viruses mutate continuously. We can be smarter if we, like the Taiwanese, are willing to learn from our mistakes. I believe that a multi-payer private system has shown it cannot be responsive or humane, and so I continue to work for Medicare for all. Thank you.